Attention deficit hyperactivity disorder is a chronic condition that affects millions of children. ADHD includes a combination of persistent problems that can range from hyperactivity to inattention to impulsivity. People who are diagnosed have two main different options for treatment: medication or natural therapy. Mary Catherine sheds light on this rising epidemic.
ADHD is a common diagnosis among children today. Coppell Sr., Riley Hopper, has been dealing with ADHD throughout her life and continues to struggle with the symptoms that ADHD entails.
Growing up with ADHD was kind of hard because I would always try really hard in all of my classes and I always fell behind everyone else. I just kind of learned how to put in extra work. So I would attend tutoring if I needed to, or I would ask people for help when I needed it.
One option for treatment is medications such as Vyvanse and Adderall. We spoke with Coppell doctor Tony Swaldy, who says that medications can have a big effect on one's personality and work ethic.
Medications help with the symptoms. And so if a person is having problems with inattention and focus, it helps with that. But it doesn't fix the problem.
Other doctors take a different approach for treatment that can help children cope with their diagnosis naturally. At Shine Through, doctors make changes to environment, nutrition, and body realignment, as well as an exercise with oxygen. These treatments have been found to be beneficial for approximately 40% of ADHD children who choose it.
A lot of times ADD, ADHD has a oxygen issue to the brain. So that's exactly what we're trying to target. And like Adderall, Ritalin, all those things, they give you the blood flow to the brain. But you can also do it naturally with oxygen.
The American Psychiatric Association states that only 5% of American children actually suffer from the ADHD disorder. However, the diagnosis is actually given to around 15% of American children. Doctors are noticing that we live in a culture where we are pressured to do more, and students are taking to medications in order to help with the timely workloads, despite the many negative side effects such as headaches and uncommon behaviors.
If somebody says, "Oh, I took my friend's Vyvanse or Adderall, and I studied for 4 hours straight, didn't stop. I was so focused. I must have ADD. Well, no, you don't. You did what anybody would do with a stimulant. You were able to focus more.
Sometimes it can be frustrating knowing that I have to take it to even be up to speed with them, and people can take it even though they don't need it, and they can perform even better than they did without it.
The amount of people diagnosed with ADHD is expected to continue to rise in the future.
I probably wrote 5 prescriptions a month of this when I started practice, and now I write 5 prescriptions an hour. We're probably overdoing it a little bit.
For KCBY, I'm Mary Catherine Ferguson.